A remarkable transformation has taken place in Vietnam over the past half-century, with life expectancy increasing by a staggering 30 years. Today, the average Vietnamese can expect to live to 74.7 years, surpassing the global average. But here's where it gets controversial. While we're living longer, we're not necessarily living healthier lives. Imagine a group of alumni, now in their 70s and 80s, reuniting at their alma mater, the Hanoi National University. With silver hair and walking aids, they gather to reminisce about their youth. One of them, Han, recalls her class of over 80 students, who grew up and studied during challenging times. This tradition of reunions has continued for decades, but each year, fewer attend due to health issues and the passing of their peers. In the 1960s, when Han graduated, the average life expectancy in Vietnam was a mere 45 years. Fast forward to 2024, and the General Statistics Office, GSO, reports a significant increase to 74.7 years, surpassing the global average by over 2 years. This improvement is largely attributed to better living conditions, societal development, and increased public awareness of health after the war. However, the story doesn't end there. While life expectancy has increased, the quality of life in these additional years is a concern. Professor Dr. Nguyen Dinh Cu, an expert in population studies, highlights that while Vietnam's average life expectancy is higher than the global average, the healthy life expectancy is lower. In 2019, a 60-year-old Vietnamese man could expect to live an additional 12.9 healthy years, compared to 14.8 years globally. Women fare slightly better, with an expectation of 16.4 healthy years, compared to 16.6 years globally. Many seniors in Vietnam face multiple health problems, including arthritis, hypertension, chronic back pain, and digestive disorders. Unhealthy lifestyles, such as excessive drinking and smoking, also contribute to these ailments. Factors like poor nutrition, pollution, and the rise of lifestyle diseases further exacerbate the issue. Lê Thanh Dong, director of the Ministry of Health's Population Department, predicts that by 2038, 1 in every 5 Vietnamese will be over 60, making up 20% of the population. The GSO forecasts a significant increase in the elderly population, with 17.2 million by 2030 and 27 million by 2049. Vietnam's traditional culture, where the young rely on their parents and the elderly rely on their children, is facing a shift. With an increasing elderly population and a decreasing birth rate, there are fewer young people to care for the elderly. Many families across Vietnam have experienced this generational shift in the past decade, and these changes are transforming society, particularly in terms of population trends. According to the GSO, in 2009, 18% of elderly people lived alone or with just their spouse, and this figure increased to 27% by 2019. This highlights the challenge of caring for the elderly in the future. Experts recommend updating the elderly healthcare system to include long-term care, comprehensive support, and an improved quality of life. This involves training geriatric doctors and developing young healthcare professionals. Nguyen Trong Anh, director of the National Geriatric Hospital in Hanoi, calls for developing specialist medical professionals in geriatric care to manage chronic conditions like dementia, Parkinson's disease, and cardiovascular diseases. The Ministry of Health has proposed offering scholarships and tuition support for students studying geriatrics to develop a skilled workforce for elderly care. Additionally, they've proposed policies such as government-sponsored health insurance for elderly people without coverage, addressing the aging population. For Han, living with her children, she believes in maintaining her independence by taking care of her health. She follows a balanced diet, exercises regularly, and takes supplements. She adheres to her medications and attends checkups. Han hopes to continue participating in reunions and meeting her old friends for many more years, striving for a happy, healthy, and fulfilling old age.